I'm Jake from Dry Creek Physical Therapy, and I'm over our hand therapy program. Kettlebell is an awesome tool that we can utilize. So a few of the exercises, we're going to go into wrist extension first. So grabbing the kettlebell in one hand and bringing the wrist back into a neutral position. What you're trying to do here is strengthen up all the extensors in the back of your forearm. Let it stretch those extensors and pull it back into contraction. Also, if we hold the inside of the kettlebell, we're going to work different aspects of the intrinsic muscles in your hand, which are important for gripping, strength, and overall capacity as we're trying to utilize those hands. The following of that, we can flip into flexion. Flexion, we're letting all the flexors in that forearm that get really tight from any kind of our gripping or manipulation activities, letting those stretch out and pulling them into a contraction. Stretch and pull. And what we're trying to do is get that length and overall contraction of the flexors to help build that strength and stamina. Deviation is our ability to take that wrist into this position, and so letting that fall off to the side and pull up into what's called a radial deviation, or deviation out to the thumb side. This is going to help strengthen up the thumb and its adjacent kind of tendons that cross the wrist and help stabilize the hand. One of the other things we also want to think about is supination. Supination is when we're taking that palm from a palm down position to a palm up position. As we're supinating the palm, we're creating that strength inside the forearm, inside the supinator, that's going to help keep it in its position. One of the other things we have to make sure we're thinking about is the aspect of the strength of the shoulder. The shoulder itself is one of the foundational aspects of our hands. If we can keep the chest up and shoulders back, we can take the kettlebell in an upright position, working on contraction of both those flexors and extensors that we talked about, and use that to stabilize that shoulder overhead. If we don't have the muscles on both the front and the back of the shoulder working together, it's going to make it difficult for everything along that pathway to stay in its position.